What is going on, nerds? We have a special COVID deep dive with the two nerdlings who are going to get all of the super chat money after YouTube takes its cut. What are you guys going to use the super chat money for? So people know if they give you a super chat what it's going to.
I'm probably gonna use it to help so I can get an electric scooter. I'm spending up.
Speak up, boy.
I am spending up for an electric scooter.
You're saving up.
Spending. Okay, saving up.
You're not spending up. Well, you will be spending up. What about you, Brandon?
I am going to either buy something on Amazon or just save it up for like when I really need to like keep it average.
Look at you. Very responsible. All right, here we go. Before we start looking at the COVID charts, let's warm it up with Andrew.
There's no place to hide now that he's arrived. I'm saying he ain't playing now with this campaign. Bang, dang, it's and Drew, come roll with the gang gang. Drew gang gang, that's who I hooked up with. Drew gang gang, that's who I hooked up with. Drew gang gang, that's who I hooked up. Yo, there's no place to hide now that he's arrived. I'm saying he ain't playing now with this campaign. Bang, dang, it's and Drew, come roll with the gang gang.
Hello, nerds! Ready?
Yes.
2 claps. Ready? Woohoo! Dude, we didn't even practice that. All right. We're here to do a little COVID live stream because we haven't gone into the COVID data in quite some time. And, to be honest with you, I thought we were done with the COVID. Didn't you think we were done with the COVID once they had the vaccines ready?
Yeah, I thought it would just fade away and we go back to normal. But of
Here
course,
we
we
are.
didn't give enough vaccines to other countries, so it mutated.
Well, we even didn't give enough vaccines to our own people here.
Well, they rejected it.
That is true. They did reject it. Oh, I see Nell Nieves is here. Nell got the COVID.
I remember.
And he's been having I think he had some longer term symptoms around smell and taste. Nell, did you ever get vaxxed? I hope so. If you haven't, please do. But let's look at what the data says.
Oh!
What?
Oh, let's go. Thank you.
Cow!
Thank you, Nell.
Oh my god. Thank you so much.
So you got to say his name.
Thank you,
Thank you,
Nell
Nieves.
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 Gong. Get the gong.
All right. It's not a concert over
It
here.
is.
Not a concert.
Got
Thank you,
free
Nell.
money.
Thank you, Nell.
Thank
All right.
you.
Let's look at some data. Share screen. I haven't done this in a while, to be honest with you. Oh, he got his first on Monday. Nell, my God, bro. Dude, I had my second in like May. Well, better late than never. And I'm glad you got it because I think, well, we're going to find out why.
I'm going to be a chat.
Let's see here at the latest. And this is current number of cases in America. So look at this, guys.
Oh, what happened?
Here's where we are. This was a year ago. We are actually having more COVID now than we did a year ago. As a reminder, around here is when the vaccines became available, like around January.
It got
right?
even.
But you can see the vaccines started to pick up, started to push everything down, and then Mr.
what?
Delta came to town.
Really?
Yeah.
What
And
time
then
did Delta
I guess
come?
it's interesting. I know President Trump was convinced that the hot weather would kill the COVID. But now a lot of the Trumpers are saying, oh, the hot weather is why we have more COVID. So I don't know what their position is these days. But who would have thought that a year after we from a year before, we were actually had less COVID than we do today. Isn't that crazy?
Somebody said something smart in the chat.
Oxford Pursuant has initiated a study of the horse medicine. Okay, yeah, they may have initiated a study, but let's let them. You know what's interesting is some people, I'm not saying Bobby, but I know Bobby's asking about the ivermectin. Some people are really concerned about the Pfizer vaccine, but then they're like, let's go with hydroxychloroquine. Let's go.
Yeah, like they're
Right?
literally killing themselves.
Let's go with the ivermectin. And
I
it's
remember.
like, wait a minute, like you're willing to ingest the bleach and the hydroxy and the ivermectin and the Regeneron. Regeneron is even
Regeneron, the
less
ad.
data, but somehow like Pfizer and Moderna are like, no, can't do it. So, any rate, let's take a look here.
I heard that
So that's the number of cases. What about hospitalizations? Look at that. The hospitalizations are actually higher now than back in August. And then the death rate, a lot of the Trumpers would say, oh, but what about the death rate? The death rate's no problem. Only like a few people are dying. And here you can see now the daily deaths from COVID is 1,281, which is a 95% increase over the last 14 days.
it could be worse,
Yeah, that's true. It could be worse.
or it could be better.
And this is Florida. Good old Florida. That
It's
is
like
governed by
literally dying.
Ron DeSantis. They call him Death Santis because he made it, he tried to make it illegal.
Oh, that sounds a lot like death sentence.
Yeah, Ron Death Sentence. He tried to make it illegal for schools to require masks. Like, who does that?
It's like,
Who does that? Who says no? Local? And what's funny is that Republicans always talk about local control. Let the local towns do what they think is best.
Ooh, verified nerd.
Oh, we got a new member, Beverly Weber. Welcome, Beverly. So that's just kind of nutty. Thank you for calling out the new Beverly member. So that's Florida cases over the last 90 days, all time. Now, last 90 days,
Northeast is doing good.
this is the rest of the country, and then that's Florida. Northeast is doing good, Midwest is doing good, West is doing good, but the South is not doing good. And Florida in particular is doing really badly. I mean, Florida is the black line. It is. Florida has more cases actually than they've ever had in the history of COVID. Let's just say that again. Florida now has more COVID than it's ever had, despite the fact that now we have had a vaccine available for like the last 9 months. What do you think about that?
yeah, I think it's crazy how.
It's very sus, right?
Yeah, like how.
Very suspicious
Sus.
Very
among
sus.
us.
All right, so let's see what other data we have here. This is hospitalization.
Oh, whoa!
Now look at
so
this.
red.
It's not just, it's okay. So here is the Southeast.
Neb. What is Neb?
There's another argument that I've heard from the Trumpers. And the Trumpers say, oh, all the COVID is coming from other countries. They're coming from the border states. But if you look at the Southwest, right? The Southwest here, Southern California, Arizona, New Mexico, they border other countries. But they don't look the same as Florida and Georgia. Look at Georgia. I mean,
So
this
red.
is just.
What is that? It's like black.
That is called Taylor County, Florida.
Oh wow, it's like
60
Yeah,
per day.
they have 274 cases per 100,000 people. And look at their trend. See if I can zoom into Taylor.
Or you could look down there.
Florida here. God help us.
It's like
yeah, there's
it's
Taylor.
like not even red, like black and brown. It's like
This is Taylor County in the last new report over the last 14 days. So this is their 7-day average, and it just keeps going up. Their positivity rate is 25%. So 1 out of 4 people
will die.
who get tested, are testing positive.
Yeah.
Well, yeah, I mean, but very
And
close to die.
52% increase in hospitalization.
Oh wow. Yeah.
On average, 59 cases were reported in Taylor County, a 137% increase from 2 weeks ago. 1 in 6 residents have been infected. Extremely high risk. Average cases per capita. The whole of August, it's like black.
And January 2021.
Yeah, this is not. You do not want to be.
Somebody asked, what website is this?
This is New York Times.
New York Times.
But if they want, we're also going to be using another one, World of Meters, and we can look at CDC as well. Okay, so now let's go back. And I wanted to show you some other charts around where are the people getting hospitalized. It's pretty much similar. You've got just in, like, Grandma used to be in Orlando, and there's 1,300 patients in Orlando that are being hospitalized right now.
So we kind of saved her.
We may have saved her by bringing her to California. Yeah. So that's the hospitalization data. Now, if you were wondering about the death rate, let's see. Hospitalizations, U.S. trends. Here's the deaths.
Wow, they're actually up there.
Oh yeah, there's a lot of people that we used to live in. I grew up in New Jersey.
Why is it so much more deaths?
It is highly concentrated, right? Because there's a lot of people live here. So this is just like total number of population. Yeah. So that's the death rate. And then here, let's see. I think we're up to now, 1,200. There's 637,000 Americans right here that have died of COVID so far. Now, if you're wondering, like, hey, don't pick on Florida, what are the other states that are doing really badly? If you look at like per 100,000 people, Florida is the worst. Okay, this is the number of cases per 100,000, or you could look at hospitalization per 100,000. Florida is the worst, that's 79 per 100,000. Oh, you can even do by deaths per 100,000. Let's see, where's the most death? Virgin Islands, Mississippi, Louisiana, Florida, Arkansas, Nevada, Texas, South Carolina, Wyoming. Arkansas, it's pronounced. It looks like Arkansas, but it's pronounced Arkansas.
How many deaths does it have per 100,000?
Arkansas has 1 death per 100,000.
What about
And Arkansas has, hold on, they have 45 hospitalized per 100,000, and they have 69 cases. Wow, look at that. Out of 69 cases per 100,000, they have 45 that are requiring hospitalization. Now, that's a number people don't talk about. Basically, if you take this hospitalization number divided by the total, you can see the rate of hospitalization. You guys tracking me?
Yeah.
So there's 22,000 people in Florida that have COVID. 17,000 of them are in the hospital.
Wow.
That's like the highest in the United States.
Yeah.
It's not
in
even...
Texas,
Wow.
They do everything
What?
big in Texas. 15,000 daily cases.
8,000.
14,000 are in the freaking hospital,
That's like,
right?
if you get COVID, you're in the hospital.
That's how serious this thing is, man. So anybody who's thinking about like hasn't gotten vaccinated yet, please, please, please consider it. Now here's where the vaccinations are happening. So the darker the color, the more people are getting the vaccines. Like over here, like Arizona, a lot of vaccinations. Seattle, a lot of vaccinations.
Florida's actually picking up.
Florida is getting some more. Not so much in Alabama and South Carolina, like this whole area here. And Georgia, I'm guessing, is not reporting. We don't know what they're.
This area is pretty good.
Yeah, this area here, Tennessee, I think they call this like parts of this area is like the Ozarks or something like that. That's a area where there's not a lot of vaccination. So that's the vaccination rate, and then risk level. So this is where you have to. It's easy to talk about Florida and Georgia and South Carolina, but there's risk everywhere right now. This Delta is spreading like crazy, way more than the COVID Classic.
We're actually in a risky area right now, extremely high.
Yeah, so we are in San Mateo County.
Yeah, so it's a little bit safer, I guess.
Yeah, we are Alameda. We're here. We have 135 cases per day, 18 cases per 100,000. That, and then Grandma used to be, oh, come on, where the heck is? Somewhere around here. Hold on.
Either way, it's pretty bad.
What county was it?
It was Orlando, but I'm not sure exactly how to find Orlando. I'm not super familiar with Florida.
Just look for the place that looks the most dark.
All dark.
Well, they're roughly around 100 per 100,000. Oh my God, 181 in some parts. And then our brother Peter is in Miami, and they have Uncle Peter is 87.
That's pretty bad.
87 per 100,000.
Just notice the big words of extremely high risk. Where are we?
We're here,
Yeah.
18 per
Oh, okay.
100,000.
But very
right?
high risk. What is that?
Not too shabby, actually.
We're purple. We are into this
Confused.
very high, and they are in the extremely high.
Nebraska.
Where do you want to be?
Square.
What is
No
that?
data, unknown.
Nebraska is.
But if you're
not
like
reporting.
in Emerald County, Nevada, or if you're in Montana, it's not too bad. So, or Maine, Massachusetts, you guys were pretty safe when you guys were in Massachusetts this summer.
Kind of safe.
Yeah. All right. So that's the data on US. Now, we're going to look at the rest of the world.
That's like
This will be interesting.
Florida is a big amount, but
Yeah.
like all of this, that's just the United States.
All right, we got to look at the rest of the world. Before we do that, we need to give a thank you to our channel members. And so let me do that. Let me do a little shout out
Oh,
to the members.
please do not tell me to read all the names because I get confused
Okay, I'll read them.
and I don't
But
know
you
how
guys
to
can just
pronounce them.
you can just
and I get
you
like,
can just
Mom.
All right, we got Soldier 1, the highest level.
Woo!
We need some claps for Soldier 1 because he's senior vice
I can
president.
ring the bell, right?
Yeah, ring a bell for Soldier 1. Thank you, Soldier 1. Thank you, Soldier 1.
Respect.
Respect, because you know
That's
this channel is not like super hot right now because Andrew Yang's no longer running for office, but you know there's still a loyal nerd following, so we're gonna keep doing data and long interviews. We got Bike.
Bike.
We got Kristen Slevin, Laura Lane, Patrick Dunn, Richard Johnson, and Bike. Vice presidents.
Oh wow, that's good.
Vice presidentes.
F in the chat for them.
What does that F mean?
It's respect.
Yeah.
How does F mean respect?
You
It's
wouldn't
like
understand.
from a video game.
You wouldn't understand.
You have
What?
to press F to pay your respects.
Huh?
Mhm.
Okay. Fine.
It's not a secret thing. Like
I would have
everybody
thought R would be respect. But,
No, it's
okay.
the video game controller. Like
All right. Then we've got Mike Chang, Gene, David, DK, Phoenix, Jekalago, Kirsch, Mr. History, Byron, Mona, Susan, Yang, Tony, Robert, Dean, Statner, Galessa, Jay Perrin, AA, Jay Bryan, Vivian, Dana, Flavio, Yoda, Jason, and Parth.
Where's your mama? I mean, your mama.
Your mama is not here yet, dude.
What?
Those are the hardcore. So thank you, hardcore. And then at the verified level,
He's gonna be here, right?
we have V, Helen, Lisa, Sugar, Albert, Brandon,
There
Brian,
he is.
Peter, Arez,
Your mama.
who?
Your mom.
Your mama.
Sophia, Jedwiga, Mike, Doris, Emerald, Lori, Ben, Roger, Lisa, Christina, Vaughn, Rasta, Jessica, Elizabeth, James, Emma, Hui, Ira, Shoni, Philip, Jameson, Doctor, William, Karen, Monica, My Ardent, Semery, David, Brittany, Sasha, Wana,
Slow
Warren,
down and take a breath.
Reddy, Lukey, Kevin, Beverly. So many members.
Oh,
we love
Beverly
it.
was just there.
Beverly's our
Was
newest.
The one that just got.
Yes,
Welcome
she
to
is our
Verified.
newest. In terms of our newest members, Beverly Weber is the first new member we've had in 2 months.
Let's go.
She broke the
Oh,
seal,
A
Beverly.
bunch of people heard their name.
Broke the seal. All right.
What did you say?
She broke the seal, man. We had no new people becoming members.
And now we have one.
And now we have Beverly. Thank you, Beverly.
Thank you.
Thank you very much.
F.
Okay, respect. Now let's look at the rest of the world because we're not the only ones dealing with the COVID. Okie dokie. Global data from Worldometer. Okay, here we go. $200 million.
What?
748,018 COVID cases.
What?
Million.
4.5 million deaths.
What?
Now, I know some people out there are saying that
Someone
COVID.
wants to look at Thailand.
Okay, I will. I'll do that, Beverly.
I don't know how to.
Some people are saying that, hey, this is a hoax just to make President Trump look bad. This is like manufactured, all the, but you'd have to convince yourself that the entire world is in on this mass conspiracy just to make Trump look bad. What do you guys think?
I think
You
that
think,
I think that's.
dude, we
just
can't
sad.
even coordinate to reduce global warming or do like fair trade. How the hell are they going to have a global conspiracy for 2 years for a guy who's not even in office anymore?
we should have a goal.
Now, the good news is almost 200 million people have recovered. The problem is many of them may have long COVID. You guys know about long COVID, right?
Yeah.
I actually just shared a story about long COVID, a study that found that 6 months into it, something like, what was it? Let's see if I can find the news report that it was New York Times. Where the heck is that? Oh, maybe I put it on my Twitter. Hold on, guys. I need to show you this thing about long COVID.
I just saw Nell in a Twitter post.
Yeah, Nell's legit, man. He's like old school Yang Gang too.
Is he like popular?
Yeah, he's very popular.
We give him a lot of mentions in our videos, so
We do. Oh, here, look at
I'll
this.
just close the door.
Let me show you guys something. If you're wondering about whether or not you want to get vaccinated, let me show you something. I know we're supposed to be doing world meters, but check this out.
Wait for me. I need to see.
This is the San Diego hospital COVID hospitalizations.
Singapore had 55 deaths.
13 hospitalized who were fully vaccinated, 521 who are not vaccinated. You see? You feel me?
You need to get vaccinated if you haven't already.
Get the vaccine.
You need to get the vaccine.
If you can, get it.
Yeah. Seriously. What?
I just saw that.
I know. It's crazy. And then, this.
Oh, thank you, Nell, for saying that.
What?
He says super chats are going to the boys. Donate. Don't let them let them splurge.
All right. Here is the daily trends from the CDC. Some people are like, "Hey, I don't trust the New York Times."
Then
So that's the CDC data. And I can give you a bigger version. This is new admissions of patients. It's actually getting close to the peak. Remember right after Christmas?
Yeah.
Like this is with a full vaccine ready for people, and it's still
and they don't
bonkers.
want it. Like some
They don't
people
want it, no.
are begging for it, and some people are like,
It's very sad, dude.
some people are like, no, go away, we don't need that.
I'll show you another thing that I had found that I had just shared. Let's see. Oh, by the way, if you have a crazy uncle
Then
that says, "Hey, if you can smell a fart with a mask, why should you wear one?" The fart smell molecule is 100 times smaller than the COVID
Interesting.
virus. So
next,
that's why it is possible to smell a fart through a mask, but block COVID, especially if you have an N95.
yeah.
Definitely get the N95.
Unless you
The
have
normal cloth mask is no bueno.
Sometimes people have really stinky farts.
That is true.
It's like
That is true, especially
not-
Daisy, our dog.
Oh my
God.
God.
Oh my
It's
God.
literally-
It smothers people.
It literally like you have to walk away once you know.
It's hard to watch the.
All right, let me show you guys this video.
Somebody uses a military
Yeah, but I have to do
grade
with
mask.
audio. Oh, military grade.
Like
Now,
gas.
that's
I
legit.
cannot smell farts.
Oh, really? Who has a military grade mask?
I don't
Ira
know
Blankenship.
why.
Nice.
Then you're
Legit.
definitely
Then you're
not
definitely,
gonna have
yeah.
COVID. No, I mean you might have
drag
COVID, but you're
on
not
as
gonna
Americans
know.
refuse the vaccine
I
in
guess
the name
nobody
of
knows.
freedom.
You're talking about an unproven, untested vaccine that doesn't even seem to really protect people because people who've gotten the vaccine are getting sick.
I went to one of the places with the worst vaccination rate.
I don't want to poison.
So just to be clear, you can still get infected after being vaccinated. Like our uncle Peter, he got vaccinated and still got COVID because he was out clubbing and kissing girls on the dance floor.
Yeah.
But at
So-
least he didn't have to get hospitalized,
Mhm.
right? So,
He's so
if
lucky.
someone says to you, "Hey, I heard you can still get COVID if you get the vaccine," it's sort of like, yeah, you can still get into a car crash if you have airbags, but you'd rather get into a car crash with airbags than without.
Yeah.
Do you feel
Or
me?
just die.
What?
What?
Or just die, like without the airbags, right?
Yeah, but you would not want to die,
Yeah. Or you
Yeah.
can be like,
or you can live.
Yeah.
or you can
try live.
un-airbag. You can be an un-airbagger. That's
Yeah,
not what you
Anti-airbagger.
want.
Forced into me.
Tired of y'all trying to control us. One of the best things we have is our own God-given natural antibodies.
It also has one of the worst COVID case rates in the country, the Ozarks.
I don't take the flu shot. I don't take the pneumonia shot. I don't take any of them.
I wanted to find out why residents here aren't getting vaccinated.
You're trying to mask these kids up. It's detrimental to their health.
What?
That's not true. It's actually,
It
will not hurt them.
It's
I-
kind of like
I
the
am a
opposite.
child. It does not hurt me.
Are you okay with the mask?
Yes.
How have you been doing the mask?
But where are
I'm
the
totally
studies?
getting
Where are the
killed.
studies? Where are the studies? I need to see them.
And And what, if anything?
You know, the thing about masks is if people think that they...
Let's go.
Thank you, Elizabeth.
Thanks.
Say, you gotta say their name,
Thank
dude.
you, Elizabeth. Norris.
Yay.
All right.
Thank you.
So here's the thing about masks. If you think that
Are we
they're
gonna
so
celebrate?
useless, what happened to Brandon?
That was good.
He crawled out.
Brandon. Okay, come on. If you think they're so useless, why do you think people in hospitals wear them? Why do you think doctors and nurses wear them? Like, do you think
They
they
don't
wear
care.
them because it's like a
Well,
fashion
sometimes
statement?
they wear them for
Protection.
for protection from like.
Yeah, exactly.
Yeah.
Yeah, no, but like
Convince them
before
otherwise.
COVID, they used to.
Yeah, for all
Yeah,
types
for-
of viruses.
Yeah, exactly.
Hey, Mr. Green. It's Dr. Martin here. How are you? I heard you had kind of a rough night last night.
Christopher Green is 53 years old and fighting for his life. Like 90% of the patients in this packed hospital, he's unvaccinated.
He's just walking a very thin, tight rope right now. And to be honest, I don't expect him to get out of this without being on a ventilator. And if he has to be on a ventilator, I don't expect him to survive.
I immediately asked Christopher, why hadn't he gotten the vaccine?
I'm more of a libertarian, and I don't like being told what I have to do. I'm still not completely 100% sold on the inoculation.
It was eerie to hear Christopher insist on his individual freedoms, even as he struggled to breathe.
So this is like a classic case of people understandably do not like to be told that they have to get vaccinated. So I think our
The thing is,
messaging needs to be that we really encourage you to consider getting vaccinated for your own protection and that of your neighbors, your community, and your country.
Mm-hmm.
But nobody's telling you
That you have to.
you have to do it.
Or you could end up like one of these.
But there are examples where it can be pretty bad if you don't.
Do you think other people should get it? I mean, I think that's everybody's individual right.
Thank you.
Thank you, Beverly.
Thank you.
And thank you for the
Thanks,
joining the
Member.
The member.
Okay, come on, put it down, man. Thank you, Beverly.
Sorry, I
Guys,
just
we're-
liked
this is
to
a serious
thank
part of
them.
the video, though.
A choice to do what they want to. So I'm not one to dictate or make somebody feel guilty because they don't.
So he has a good point there, right?
Christopher represents a genuine challenge. Do the American values of individual choice have to take priority over public health?
By the time they're here, what can you do? You know, and it's when somebody's in a room really, really sick and can't breathe and suffering, I mean, it's just not a good time for a lecture.
But the result in a place like Mountain Home is a 36% vaccination rate, and people are dying.
Let everybody live their own life.
I heard this over and over. Freedom, choice.
Don't do it because somebody's pressuring you to do it.
Everyone has the right to choose.
Almost everyone I met in Mountain Home told me they knew someone who died from COVID. Most people are undoubtedly concerned about the pandemic here. It didn't feel to me like a QAnon convention.
All right, so that's a little bit of, and unfortunately, the guy that they interviewed, the libertarian guy, he has since passed away from COVID.
He kicked the bucket.
Yeah, and so we should remember that we might disagree. We might have wished that he had gotten the vaccine, but that guy was someone's father, someone's son, someone's brother. And, you know, he was a libertarian that didn't want the government telling him what to do. And somehow we've gotten to this place where getting a vaccine has really become a political, like, my party versus your party debate. And people are literally dying because of it. And
Even though he didn't get the vaccine, I mean, he's a human being.
yeah, like, and you know what? He might have been influenced by leaders of political parties that told him don't worry, you can get Regeneron, you'll feel better overnight, everything's fine, don't be afraid, don't be a sheep, be a lion, don't be a sheep, be a goat. And now, people believe that stuff,
But
and
the
here
thing
they
is,
are.
how are you gonna get the Regeneron? I mean, it's like only a few people can get it.
And it doesn't save you.
Yeah.
It doesn't
you know?
save you. Just
So, I mean, it
I
can
mean, it
help,
helps,
but so can a vaccine.
the vaccines help.
But the thing is, nobody asked for the data about Regeneron, because I think Trump recommended Regeneron, so people are like, oh, I don't need to see the data. Trump recommended hydroxychloroquine, so they're like, oh, I don't need to see the data. I don't mind that Regeneron is experimental.
Trump is like,
but for Pfizer and Moderna, they're like, oh, I don't know about that. Anyway, so let's look at we got to go back. We got a little off track. We're now going to go to rest of the world. Before we do that, I want to give a quick shout out to the Of the People project. And Of the People is something that me and some other folks have volunteered to build. It's kind of like Yelp for new political candidates, and you can filter it by policy. You could say like, hey, who are the top UBI candidates? And right now, shout out to Erica Rhodes, Shervin Azami, Ali Dalsimer, Sass, Brittany Ramos de Barros, who was just on the Nerd Show this morning, Teresa Kang, Austin Searle, and Sheridan Lund. There's probably more. I'll read them all. Corey Legendra, Christy Seelock, Ryan Stark, Erica Smith, Alan Ellison, Badrun Khan, Jesse Phillip, Eric Storzen. This is all sorted by whoever has had the most approval votes. So if you go to OTP, you click on a candidate, you click on this approve button after you log in, then they get voted up, and then that basically figures out who's trending. And right now, Erica Rhodes and Shervin Azami and Ali Dalsimer are our top three.
I have a question.
Yes?
Who made Of the People?
Me, Ian Schaefer, Don, Lucas, Sam. Those were kind of the key Of the People folks. And we've had other volunteers along the way as well. So a lot of people have volunteered to make that happen.
Oh, okay.
So check it out, ofthepeople.us, approval vote, whoever you like, discover new candidates, and hopefully you'll donate and volunteer for them. Okay, now we're going to go to the rest of the world data.
All the stuff you saw was mostly just United States, but there's more.
Yes, here we go. Okay, daily cases in the world. Pretty much looks like there's no vaccine almost, right? It's pretty much as high as it was back in the end of 2020.
That's not good.
Yeah. And then if you look at daily death rate, there are now 10,000 people in the world dying of COVID. At the height, it was 18,000, 15,000 in the middle of, it got to 15,000. So that is the world. And in terms of where do you have the most deaths, America is the number one country for total deaths. But if you look at new deaths, let's see. How do I read this? No, this data is incomplete. So how about new total cases we could look at? Where's new cases? Active cases. Total cases per 1 million. Seychelles, Andorra, Montenegro, Gibraltar, Czechia, all these places have no access to the vaccine. US is number 14 for per capita cases. And then in terms of total deaths, US, Brazil, and India each have about 500,000. Mexico has 250,000. Peru, 200,000. Crazy. You want to see? Oh, someone was asking about Thailand, right?
Thailand. Yeah, it was, I think it was Beverly, yeah.
Beverly. Let's look up Thailand. Hold on. Control F.
Sometimes it gets laggy.
There it is. Okay, Thailand.
1
million cases, 11,000 deaths.
And 1 million.
And
I mean,
whoa, geez.
wow.
That is not looking good. Thailand is in serious trouble. That looks worse than Florida in terms of the chart. Oh man.
Okay, massive spike.
Whoa.
Yeah.
Is there somebody asked,
mean,
is
it
there
is
a vaccination percentage on the table?
Yes, I'll look. I don't know. It's going to be low for the table because most countries don't have any vaccine.
Yeah.
Daily deaths are now 300 per day in Thailand, the most ever. Thailand is not looking good.
Not too good, but I mean, you can always recover.
Yeah,
I think.
most people are recovering, but there are still around 300 dying every day in Thailand alone. All right, let's see. They were asking about, do you have vaccine rates by country? Let's see. Oh, what happened to the interweb? Deaths, daily cases.
That's a nice watch.
Daily deaths. Yes, it is.
Pepsi.
No, they have tests per 1 million. Where's the most testing is happening in, Peru, Hungary, Bosnia, Gibraltar. Wow, a lot of people used to say, the U.S. does more testing than anyone else, but actually per capita, U.S. is actually not. U.S. is 21 for number of tests per 100,000.
Can we see Switzerland's stats?
Yes, let's look at Switzerland.
Oh, Switzerland's
where
probably
we
not
used to
doing too
live.
good.
We don't know that. It might be okay. Let's
Well, I mean,
see
it
Switzerland.
used to be doing bad.
Because they were near Italy.
10,000.
Wow, that's a lot recovered.
A lot recovered, but their chart's not looking good either. See, this is not just a Florida problem.
We have to find what's the worst. I want to find what's the worst.
The worst?
Yeah.
It's kind of funky, the active cases. Total deaths.
Oh, total
so it's
deaths,
actually.
yeah.
Oh wow. Okay. That was. I thought
daily
it was.
daily deaths is quite low.
Wow, dude! Imagine when.
Yeah, but here it looked pretty bad. Almost 100 dying a day. 200 dying a day. 2020. We left Switzerland in July of 2020, right?
We got out there as soon as we could so that we wouldn't die.
No, we got out of there because I had a
yeah,
job
Dad's
that,
working also so that we wouldn't die.
Mm.
Both of them.
Okay, so that's what about your favorite, New Zealand? You want to check out New Zealand?
Zealand's not doing too good.
New Zealand did hardcore. That prime minister, she shut down like the moment they had anything. So let's see how they're doing.
It's like they predicted the future. They're like, we know what's happening next,
New Zealand.
so we're gonna die. We're gonna run.
26 deaths.
26
What? No way.
Total.
How? Wait, let me see the chart. It's gonna be like nothing. Oh, actually, what is that?
They have a few thousand cases, but like
only 26 deaths.
Yeah.
What?
Daily new cases. Oh, but look at that. It's creeping up. I mean, it's only 100. That's like less than Orlando, like a town in Orlando County. But, it's pretty small.
It's going to continue.
But you look at this. Look at Delta. Look at the Delta, man.
It's not good.
Yeah.
It penetrated there.
It matters.
Well, if you look at total deaths, look, it's like 20.
No deaths so far.
Those are some nice watches down there.
That's insane. Like 0 deaths.
You can see what I've been looking at on the internet based on these ads.
Look at all the watches you like.
Yeah.
Oh, there's the one that we.
No shoes. I don't look at shoes.
Look at that.
The watch.
Look at that. That's the one that we.
Yes, we like that one.
Have.
We want that one.
One of 250.
Look at that.
Well,
okay. Yeah, I don't know about that shoe stuff. All right, so I think now we'll do a quick Ask Me Anything. Ask us anything.
Can we invite somebody on the channel if they can just be
to join us, like as a guest?
Yeah. I mean, we haven't done
All
that
right.
in a
If
long time.
anybody wants to come on the
I hope they
show
do.
and have a conversation with us, DM me on Twitter. My Twitter handle is Nerds for Yang. And if
Of
you
course
do
it
that
is.
in the next minute,
Then we will let
then
you.
I will send you an invitation link to join us for a group conversation. And it could be about COVID, it could be about Yang, whatever you want. Okay. And while we're waiting for that, if in case anybody wants to go, let's see if there's any questions. No questions in the chat for the nerdlings or for me. You guys are all questioned out.
Do something for me so that I can talk.
All right. Brandon really wants a question. So
I don't
please.
really, but I do want a question. Because I haven't been having any, and I'm like.
All right. Well, see, they don't want to ask you anything, bro. While we're waiting for them, let me show you some of my own. I didn't ask me anything on Twitter. Let me show you some of the questions that I got.
I forgot, what does DM stand for?
Direct message, I think. All right.
Okay. We have a question.
We have a question?
Dogs,
and dogs. Especially yellow labs.
We have 2 more questions.
Corgis. Goldens are fine.
Yeah.
Labradoodles.
He doesn't like them. He thinks they're unnatural.
Okay, so
no,
then
and their fur is rough.
Oh no.
Yeah, and I feel like there's too many of these Labradoodles. They're
okay, so
taking over.
What design masks do you like the most?
Oh.
I like the round one. What was it called? The one you gave
94.
The KN94.
Yeah, KN94. I like those, but I also like the surgical masks.
Yeah, I like surgical.
You like the surgical, but they don't give you as much protection as the KN94.
Also.
Yeah, but you see these charts, bro.
Yeah, another one is, can you explain F? Okay.
F in the chat.
The origin of F is from a video game. So
it's a meme.
There's a photo of a dude in a video game, and one of the people in the video game didn't survive something, so they're having the funeral and stuff. And you have to press F to pay your respects. So a lot of the times in the chat on live streams and stuff like that, they do F.
All right. Nell, who gave you the amazing super chat, wants to know your favorite food.
Oh, I have a lot. Some people do that.
I like ice cream.
Ice cream,
it's just good.
I love ice cream.
What flavor?
Oh,
I like caramel, peanut butter, fudge.
Oh God, that's so good.
Don't think of it, Dad. You're on a diet.
Oh my God.
Okay, so here's one of mine.
You already have 2 tubs of ice cream in your
Okay,
food.
wait.
My belly.
One of my favorites is pear. Pear is good.
Pear ice cream is
Pear is
nice.
amazing.
Yeah.
It's so
green tea ice cream
and caramel.
too.
Yeah, green tea is
Oreos.
it just tastes good.
Smooth.
Yeah.
Pistachio ice cream. That's what you like.
Yeah.
I like green tea ice cream.
I like pistachio. I had a continuous glucose monitor on because I'm pre-diabetic. I have a high hemoglobin A1C level elevated.
Remember when you almost died?
And it was a continuous glucose monitor. It was attached to my pins into my stomach. And I ate a little bit of pistachio. Do you remember, Brandon?
Yeah.
And I said, we're going to do this for
science.
It's pistachio. We're going to do this for science. And my freaking phone
was
started going, and it was so
we were all freaking
the problem with ice cream is it's highly concentrated sugar.
It's trying to get
Of course.
It's like ice. You use lava to put it out, but then you use too much lava.
Favorite drink?
Okay.
I like root beer a lot.
Mug root beer I had today.
Yes.
Sprite also.
Yeah.
I used to never like Sprite. Milk also, definitely milk.
Almond milk?
Oh, coconut water.
And boba tea, obviously. Oh, taro is good.
Taro milk tea.
Yeah. Coconut water is pretty good.
The surgical respirator. What?
Is the gold standard. Well, that's not a question, but he's sharing.
That's a
The
very,
surgical,
very,
right?
very.
Yeah, you know, the thing I like about the KN95s is that they're very comfortable, and
Yeah,
you
they're
can
nice.
still talk.
Yeah.
All right. So I think
nobody?
so.
Nobody
Thanks
wants to go?
everybody for joining us. It's been a while since we did a live stream. It's been a while since we had the nerdlings. Thank you for all the super chats. Let's
Oh,
quickly.
favorite book.
All right, go ahead. Tell me your favorite book.
I have a lot of Asterix and Obelisk. It's about two gulls who are like very strong.
Wow, we missed some. Did we?
No, these are from before.
Okay.
Oh,
I was wondering.
So we have
No,
Nell,
no.
Elizabeth, and Beverly.
Yo, thank you guys.
Thank you very
so
much. Very appreciative. It's going to go towards your scooter
Thank
budget,
you.
and you're going to save it, Brandon, for what you might
yeah.
need. Yeah. All right.
So,
future.
Oh, wait, check
if
your
you
Twitter
have
DM.
any last second questions,
Twitter. Check that.
yeah, maybe
Twitter.
somebody-
No, nobody wanted
Nobody
to come on
wants
the
to
show.
come on the
Nell, you don't
show?
want to come on? We could talk about what Andrew's going to do. Or
please.
maybe Nell's busy. He may not have time.
No, always does, but
Nell always has time.
oh, somebody says, "What y'all gonna do for Halloween?" What an amazing
Oh,
question!
that is a
What
great
a
question.
good question for me to think about.
Tell
Okay,
what you're gonna do
you
for
guys
Halloween.
do not know, but
You want to go get your Halloween mask and show them what you did last year?
Okay. let me
Don't
get-
knock over the green screen, bruh.
It's a green. Okay, fine. I'll get my mask. I'm not gonna wear the suit. It takes too long.
All right, favorite book for you, Ryan?
That's a good question. I liked Animal Farm. That was pretty good.
Really?
Yeah, it was a good book.
You read that for your Revolution thing, right?
Yeah. It's a pretty awesome book.
Animal Farm. Wow. Okay. For me, I recently read a book called Positive Intelligence by Sharzad. Positive Intelligence. What's Sharzad's last name? What the?
That's sus.
How is it? Sharzad Shameen. Sharzad Shameen. If you haven't read Positive Intelligence by Sharzad Shameen, you are potentially missing out on increasing your impact on the world by 10 times. Seriously. Oh! God darn it. Oh my God, dude, that is still creepy. Even after, no, it's like delayed. Okay, please go away now.
That thing is.
It's very disturbing and it makes me uncomfortable. All right. So I think we're going to say goodbye. We want to thank everybody for the super chats again. You guys are very generous. And any closing words, Ryan?
You should probably get vaccinated if you haven't already, I guess.
Yes, we invite you to strongly consider getting vaccinated. And then even if you are vaccinated, you may want to whip out the N95s when you're indoors, because you could be around people who either are not vaccinated or are vaccinated but are still transmitting Delta. And some of the long-term effects, like the brain fog, there's someone that I used to work with who was in his like late 20s, and he was a super fit guy, and he can't work anymore. Like he can't speak for more than 30 minutes without getting extreme fatigue. It's our neighbor, his brother-in-law still can't taste after like 9 months now. I can't smell anything. And then there are plenty of cases of some people in the Yang Gang. One of the guys was telling me he used to run like a 7-minute mile, and now he's at an 8-minute mile, and he's super fit. So just really, please get vaccinated. And even if you are vaccinated, get fully vaccinated. And even if you're fully vaccinated, wear an N95 when you're indoors, especially this winter. It could get a little dicey. So with that, I'm going to say Goodbye, nerds.
Goodbye, nerds.
Goodbye, nerds.
Love it. See you guys later. Peace.